MedCram.com. Welcome to another MedCram COVID-19 update. Here in the United States, we have a slight increase in the daily new cases nationally. Daily deaths are still on the decline at this point. In the United Kingdom, daily cases are still on the rise, whereas daily new deaths in the United Kingdom are still relatively small. In Canada, the daily new cases seem to have reached a peak. We'll have to see here what direction it goes with more time. And while there's been some recent activity in terms of daily new deaths in Canada, this may be on the way down. In Brazil, the daily new case rate seems to be going down here every single week. And we're seeing a similar trend as well in terms of daily new deaths in Brazil. And if we look at Finland, which we looked at a number of months ago in terms of their hydrotherapy and their proclivity to use saunas, we can see here that the number of daily new cases is on the rise. But there's really been a paucity of actual deaths on a daily basis here in Finland. If we try to compare that to Sweden, we see here that the daily new cases are on the rise. But in terms of the daily deaths in Sweden, there really hasn't been an increase since August 1st. So that's very encouraging news for Sweden. So the question always is, what's the point if the cases are going up, but the deaths aren't going up? And well, of course, there's a lot of real estate between cases and deaths, right? There's hospitalizations, morbidity, etc. And so for that, we go to a website that's actually keeping track of this, at least in the United Kingdom, where we can see since the pandemic started what's going on with testing and with cases. And clearly you can see here that there is just a dramatic, more than 3 or even 4-fold increase in not only the capacity of PCR testing, but also in PCR tests that have been actually processed. And so because of that, you can see here, it's no surprise that the amount of cases has gone up because the testing has gone up. But you may want to notice something here. These are linear y-axes going from 0 at the bottom to 100,000, 200,000, 300,000. And here we have cases in the very similar type of progression, right? It's not logarithmic. And clearly you can see here that the amount of testing has linearly increased. Whereas here on this graph, the amount of cases has, it seems, non-linearly or maybe even exponentially increased. And so while I think it's reasonable to say that the amount of cases that we're having now, at least in Europe and maybe even just the UK, the reason why these cases have gone up in comparison to the peak that we had in May is probably a result of increased testing. But we can't say that the week-over-week increase here in the last month or two is just because of that testing. That would be my hypothesis. Now, if we go through and look and see what's going on here in terms of healthcare, here we have hospitalizations that are occurring in the beginning around April and May. You can see very, very high. And then it's dropped off considerably. And only now is it starting to pick up. So there has been an increase in hospitalizations, although nowhere near the height that we saw back in April and May in the United Kingdom. And fortunately, patients in ventilator beds and patients being admitted to the hospital. So again, this gray bar is the number of patients total that are in the hospital. The dark blue bar are the patients that are being admitted to the hospital, and then this lighter blue are the patients in ventilator beds. And of course, these are all patients with COVID-19. Over here on the side, we see the deaths. And these here are deaths within 28 days of a positive test. So, of course, there's going to be some patients which have deaths that are not related to COVID-19. But nevertheless, we wouldn't expect those to change dramatically here since April. And here's a deeper dive into the number of patients that are being admitted from the different countries that make up the United Kingdom. And you can see here that the majority of these cases are in England. And of course, that also goes for the deaths. Most of them seem to be in England. I wanted to talk about an interesting development that really has some unknown and potential insights into coming up with therapeutic options. And that is this paper that was published in Science called Free Fatty Acid Binding Pocket in the Locked Structure of SARS-CoV-2 Spike Protein. So what they're saying basically in this article is that there's a fatty acid called linoleic acid, which actually is an essential fatty acid. It's an essential fatty acid that also happens to be an omega-6 fatty acid. And apparently what they found is that there are binding sites on the spike protein. The spike protein is part of the SARS-CoV-2 outer layer, which binds to the ACE2 receptor on human cells. And so what they find is that if the linoleic acid binds to the spike protein at particular areas, it causes the conformation of that spike protein to be in what they call a tight configuration. And essentially what that does is it prevents, in some fashion, the binding of that spike protein to the ACE2 receptor. They say here in the abstract that their 2.85 angstrom cryo-electron microscopy structure of SARS-CoV-2 spike glycoprotein reveals that the receptor binding domains, or the RBDs, tightly bind the essential free fatty acid linoleic acid, or LA, in 3 composite binding pockets. The pockets also appear to be present in the highly pathogenic coronaviruses SARS-CoV and MERS-CoV. LA binding stabilizes the locked S conformation, giving rise to reduced ACE2 interactions in vitro. In human cells, LA supplementation synergizes with the COVID-19 drug remdesivir, suppressing SARS-CoV-2 replication as well. So here you can see where this binding site is in the spike protein, and you can see that there's a pocket. And when that binds, it locks the protein into a conformation that does not really encourage binding to the ACE2 receptor. Here's a closer look at that, and we can see here the chemical structure of linoleic acid. It's known as an omega-6 fatty acid because if you count from the end, which is the omega end of the alphabet, and you count 6 carbons in, 1, 2, 3, 4, 5, 6, you'll get the first double bond. And here's another view of those trimers. So these trimers, or 3 proteins, come together in this S protein. And you can see here the linoleic acid, which is this yellow structure here, here, and here. And what that does is it causes a tight conformation of this protein, as opposed to when they're not being bound, it's a much more open conformation. It's this loose and open conformation that can bind the ACE2 receptor better. In this situation, it does not bind the ACE2 receptor as well. And the thought there is that might mitigate infectivity of COVID-19 or SARS-CoV-2. So before you feel the need to increase your dietary intake of linoleic acid, there actually is a nutritional quandary, as published a couple of years ago in this paper that was published online in Healthcare. And as it turns out, apparently over the course of the last century, there's been a 20-fold increase in the consumption of vegetable oils, resulting both from their increased availability and from recommendations to consume these oils in a way of lowering the risks of coronary artery disease from elevated cholesterol. And apparently this has reached a total of about 6%, which is pretty high, of total dietary energy. The article goes on to say that there's been meta-analyses which have disagreed about the role of dietary linoleic acid in atherosclerosis. And recent publications indicate that linoleic acid's reduction of blood cholesterol levels does not predict its effect on the development of atherosclerosis. Now, because linoleic acid is a precursor to arachidonic acid, which is involved in inflammation, there is concern that there may be detrimental effects on elevated dietary linoleic acid. It's interesting to note that in a recent survey of geographic areas around the world that have longevity that was actually studied by National Geographic, the 5 areas that met the criteria of longevity, all of them, as listed here, had dietary intakes of linoleic acid that were actually below the current intakes in the United States. Now, to be fair, the authors of this study aren't really suggesting that we increase our dietary intake of linoleic acid, but rather that this novel approach may suggest itself in terms of looking for therapeutic options that could interact with these binding places. We shall see as time moves forward. In other news, we are looking at vaccination, and this time the vaccine trial that is sponsored by Johnson & Johnson has just announced that their study has been paused due to unexplained illness in one of the study's participants. Now, there are certain rules that will trip a potential pausing that would shut down the study temporarily so that they could figure out whether or not this illness was the result of the vaccine. Remember now that this is a 60,000 patient clinical trial. So with that many patients in the trial, you're bound to get somebody coming down with some severe illness. That's just the way things are. Think about that. That's about the number of people that would come to a very large baseball game or football game. The question, though, is, was it the result of the vaccine or was it a result of just chance? And so epidemiologists and clinicians are trained to look at that. I'm sure there will be unblinding of that patient to see whether or not they got the placebo or whether or not they actually got the vaccine, and then make a determination about whether or not the chances of something like this happening and whether or not the biological aspects of it make sense. And this should be somewhat encouraging because while it's not a good thing to have someone have a bad response in a study like this, we don't know whether or not it was caused by the vaccine yet, it is reassuring to know that these companies are undergoing and continuing with the same safety protocols, and we will just have to wait and see exactly what happens. And in terms of some good news here in California, the Los Angeles Times is reporting that Californians hospitalized with COVID-19 is at their lowest levels in 6 months. And that is some good news after a very beleaguering fire season here over the last couple of months. So with that, we'll wrap things up here. Don't forget to check us out on medcram.com. We have excellent courses on EKG interpretation, CBC blood test interpretation, and also basic metabolic panel interpretation. This and many other lectures, including our COVID updates, commercial-free. Thanks for joining us.